Another thing that we commonly discuss with our patients during the consultation process and the pre-op process are risks associated with surgery. All surgery has four main risks: bleeding, infection, scarring, and nerve damage. And part of your care before and after the surgery will be things that you can do to minimize those risks. So for example, the bleeding risk is minimized by having our patients take it easy afterwards for 2 weeks. So no exercising, heavy lifting, or bending over after surgery for about 2 weeks. There's a risk of certain medications can also thin your blood: vitamin E, fish oil, Motrin, Advil, Aleve, those kind of medications. So we have a list of those medicines that we recommend our patients avoid before surgery to minimize bleeding and improve the bruising after surgery. There's a risk of infection. So we put all of our patients on a MRSA protocol. And what that involves is cleaning with a specific soap around the ears and the neck before surgery, and applying an ointment in the nose area and around the ears before surgery as well for a few days. We also give you oral antibiotics after surgery, so it's very important you take those antibiotics after surgery. We also have sterile instruments, and we wear sterile gowns during surgery, also to minimize any potential transfer of infection risk. There's a risk of bleeding, infection. There's a risk of scarring, which is rare. It's also more common in my skin type than in lighter skin types, but we do monitor our patients afterwards. I'm very careful with the closure of the skin, and I'm also careful about monitoring the patients afterwards. We can inject steroids, we can offer lasers, treatments to improve any potential scarring that could occur after surgery. There's also a risk of nerve damage. Now, there's two kinds of nerve damage. There's nerve damage where you can't feel. So typically patients can't feel around the ears and on their face and under their chin for a few weeks to months after surgery. That gets better over the next 6 to 9 months. Very rarely will there be areas on your ear or your neck that you can't feel permanently. There's also a risk of damaging the nerves that move the side of your face. It's very, very rare for that to happen. It can happen temporarily, and it's very rare for it to happen long-term or permanently, but that's why I choose a surgeon with a lot of experience in facelifts or facial surgery.